What is the viable and non-viable in basic microbiology? Let's break it down in simple words with a link to current good manufacturing practices, CGMP, so it's clear and practical for pharma microbiology. 1. What is viable? Meaning in microbiology. Viable means alive, microorganisms that are capable of growing and multiplying when given the right environment. Examples: bacteria, fungi, or yeast that can grow on nutrient agar. When we take an environmental monitoring plate, settle plate, contact plate, or swab, and colonies grow right pointing arrow, those are viable microbes. In CGMP context, viable monitoring checks living contamination, e.g., bacteria, mold, that may spoil medicines or make them unsafe. Used in environmental monitoring of cleanrooms, operators, and equipment, controlled by limits defined in ISO cleanroom standards and GMP guidelines. 2. What is non-viable? Meaning in microbiology. Non-viable means not alive. Particles present in the air or on surfaces that are not living organisms, but may still contaminate drugs. Examples: dust, fibers, skin flakes, plastic particles. They do not grow on culture media because they are dead, inert. In CGMP context, non-viable monitoring is done using particle counters, like is greater than or equal to 0.5 micrometers and is greater than or equal to 5.0 micrometers particles in air. Even though they are not alive, too many particles mean poor cleanliness, which increases risk of carrying viable microbes. 3. Why both are important in GMP. Viable right pointing arrow tells if microbes are alive and multiplying, direct risk to product safety. Non-viable right pointing arrow tells if air and environment are clean enough, indirect risk, because particles can carry viable microbes. Right finger together, they provide complete contamination control in cleanrooms. 4. Simple analogy. Imagine your medicine is like drinking water. Viable contamination equals germs growing in the water, dangerous to health. Non-viable contamination equals dust or sand particles in the water. May not cause infection directly, but shows poor quality and could carry germs. Checkmark summary in one line. Viable equals living microorganisms, grow on agar plates. Non-viable equals dead, inert particles, counted by particle counter. CGMP requires monitoring of both to ensure medicine is safe, sterile, and contamination-free. Thank you so much for watching. Please like and subscribe to the YouTube channel at Pharma Update Tech GMP.